but I will introduce our speaker today. Today we have Ginny Pribanic, and she is the president and CEO of MedRespond, Inc. Ginny is a Tepper alum and a serial entrepreneur who has worked in a variety of industries, from lighting to sports entertainment to her current company, MedRespond. MedRespond specializes in using conversational AI to coach patients through preparation for surgical procedures and to help them manage their health as their chronic disease progress. The company is now preparing to launch 2 full suites of programs targeting cardiac surgeries and chronic care, and is now fundraising to support these developments. So, Ginny, thank you for coming, and I'll let you get started.
Allison, thanks. And as you've already discovered, one of the most difficult challenges of what we do is pronouncing it. So, welcome everybody, and it's good to hear from some of you and reconnect with some of you. And thank you for taking the time today. So, I love being an entrepreneur, and I will encourage everybody who's listening to follow the entrepreneurial path. And when I was getting coached for doing presentations, someone said, pick one fact of you that is unique that people remember. And so the one that we decided upon is that I get to share with everybody that I was once I was once clinically diagnosed as intense. And I really do think that that is an excellent quality for any entrepreneur to have. So there's a level of intensity, of loving what you do, of having the passion for it. And so I actually have that diagnosis on my medical records. So I come from Pittsburgh. I have my undergrad from University of Pittsburgh, and I'm an alum at Tepper. And I founded a technology using conversational AI. And what we do is we basically create a video coach that has a conversation with people as she prepares them for their upcoming surgeries. And I started working with these kinds of technologies in the Entertainment Technology Center. And we worked and experimented with different embodiments of it. We rolled it out in sports. We tried allowing people to talk to their favorite hockey player, and we did it with actors, and we even did it with Las Vegas showgirls who would educate people about what to do when you get to Vegas. And she was dressed in a Las Vegas showgirl outfit every time she answered your question. And people had interesting conversations with her. But ultimately, through all my experiences of using AI and the conversational AI in all of the areas, I really fell in love with its applicability in healthcare. And it's because people need so much assistance and so much help. And frankly, they're often shy or afraid to ask for it or can't afford to ask for it. They just don't have access to getting questions answered. So I think that we've found a really wonderful place in healthcare to help explain to people exactly what to do when they're getting ready for their surgery or when their chronic disease has progressed. And we've had some great outcomes in looking at our programs for open heart surgery, for example. Our client did a study, and what we found is that the patient preparing for open heart surgery, the average time that this patient spent with the system is about 90 minutes, and it improved their patient satisfaction scores. They said it reduced their anxiety. And when we looked at the claims expense for the people who used the program to prepare for their surgery and compared it to those who did not, what we found is that the patients who used MedRespond saved 50% in the first 30 days post-discharge. So what that means is when you got out of the hospital, you followed instructions that we gave you about infection control and prevention, and you reconnected with your primary care physicians instead of going back to specialists. You adhered to your medications better, and you avoided emergency room visits. So those were all the things that we were successfully able to convince people to do. So based upon the work we've done here in Pittsburgh with Highmark, we then began to work with the Cleveland Clinic. And similar results there. The cardiac chair has called the system that we've delivered a game changer for surgery. And 100% of the patients reported that it improved their care. 93% say it strongly did and found it to be the best way to prepare for surgery they ever experienced. So that's what we do. But I really wanted to talk today about what's the big deal about healthcare. And the first thing, and I wanted to mention, Allison, if anybody has any questions or comments, please chime in at any time. I just feel like I'm talking to myself here. And although with COVID quarantines, it feels like that a lot for everybody, doesn't it?
I have a quick question. What was
yes.
the overall, Mike Kiesel here, what was the cost savings? You said 50%, but what is the average cost for that first 30 days? Is it like $5,000 or?
Yes, the savings were approaching $5,000 per patient.
Okay,
because we're talking about the savings on the post-discharge costs, not the surgical costs themselves.
Right, correct. Thank you.
Yes. So as I go into what's the big deal about healthcare is, of course, we all know it's really big. It's 18% of GDP. It's trillions and trillions of dollars, and growing. Except lately, not so much, but generally, we're a growing industry. It's also easy to identify and understand the spending in this segment because two sectors are responsible for over half of all of that spending, and that's hospitals and physicians and clinical services. So while you're fragmented with all the different hospital systems, you really do have very, very large buyers, and you can target them easily. Everyone knows where the hospitals and physicians are and can reach into them. So you have a very large growing market that's easily accessible, and it's well understood. We know how many hospitals there are, how many beds, we know total admissions and total expenses. And if I want, I can look at various reporting and I can see the average cost of every surgery by hospital across the United States and more details than I'd ever want to find. So you have a very transparent industry as well. There's also there's a lot of analytical data, again, more than you'd want. And so what's the problem? Well, in addition to all the traditional problems in healthcare, we've got a new one this year, and it's COVID. And depending upon where you are and what you do, for some people, COVID has been a nuisance where you aren't able to go to the restaurant anymore. But for others, COVID has been a devastating experience. I have a colleague with a daughter who works in inner city New York in a COVID ICU. And just hearing the stories of what people have been through in the past year is absolutely, it's devastating. And the healthcare industry has been really hammered financially by what's going on. If you recall, it was about St. Patrick's Day last March when the pandemic was declared a national emergency, and almost immediately hospitalizations drastically dropped off. You can see the red lines and yellow lines. The blue line are the hospitalizations, admissions for 2019, and you can see what happened in the middle of March. Dropped off by 40, nearly 50% from previous times. And hospitals, the cost on operating margin, in that blip period, that March through June timeframe, it's estimated that the industry lost $40 billion a month. And if you look at the financial impact on the whole year, the median hospital operating margins declined by 5%. And that's really significant when you look at the median hospital margin is 3.5%. It's very common for hospitals to be operating with a negative margin. You know, there were a lot of federal funds thrown at the hospital systems trying to ease that pain. But even with the relief funds that were injected, the outcome for 2020 is that the margins were reduced by 1.2%. In a real world, what did that feel like? Everything was going along. We were working with one major provider, and we had implemented the programs, and we were in discussions how we could expand it across a certain, many additional surgical areas. And we were moving along in the sales cycle and the sales process as beautifully as you'd ever want. And we actually delivered the final proposal on, I believe it was March 19th. And again, that was the critical day. And after we went through the whole proposal, the conclusion was, we'd love to buy this. And if it weren't for COVID, we'd be buying this. But we've just been told that there is going to be no spending in the system that isn't directly COVID related. And we anticipate that that's going to last throughout the remainder of the year. And it did. For MedRespond, all of our projects that were directly provider related were either delayed or canceled for 2020. And I think we all know horror stories of companies that have gone out of business, people who have lost jobs. This has been a devastating time, and I think for many of us who are in business and healthcare, we've lost a year in many ways. Now, there are some winners. We're actually targeting a COVID education program to support vaccination rollout, and that's an area of bright light. And of course, before that St. Patrick's Day, telemedicine was very, the adoption of it was as slow as you can imagine, but overnight, several of the companies, the hospital systems we worked with went from having no telemedicine capabilities to installing it in all of their primary care offices and all of their specialists within 3 weeks. So it was an enormous light switch on for the digital connection within healthcare. And I think we'll always have that, and that'll be with us, and it will represent an area of opportunities, and many telehealth companies have done very, very well now. But what are the other challenges that we have in healthcare? One that I think is the most incredibly stupid in the universe is that in the U.S., healthcare is a political football. And rather than talking about the real challenges of healthcare, access, quality, and cost, we're having this conversation discussing it, is it a privilege or a right? And we're arguing about that. And as long as we are in that realm of vagueness and we're just not taking it seriously, it creates a great deal of uncertainty within the industry. Can you imagine if your specific industry was going to be influenced as directly by who won the presidential election? And no industry needs that, and that really is a challenge. We found people saying things in the third quarter, well, it all depends on who won, what we'll do here, and what we can expect to happen. And that's really a huge challenge. and an overarching one that'll affect us for a long time. One of the key considerations is if we go to expand the insurance coverage, do we have the resources to actually deliver an increase in demand? And we need to be thinking of those things before we actually do the expansion so that we can be efficient and effective at that. But more of the things, just some of the other challenges that you have is when you're in healthcare, you're talking about an innovation that can jeopardize lives. With the Hippocratic Oath, you have to improve. You can always look to improve upon the current standard of care, but above all, you have to cause no harm. And so you always are striving to improve efficiency. And a key challenge is if you implement a change in healthcare, how can you prove your direct impact? And I'll talk a little bit about that, but you can show in a financial market that you've improved the return with a new investment strategy. But if you have a new care plan, it is a much more complex, more challenging, and certainly a major time commitment to demonstrate that that improvement will deliver a benefit and then prove it in a clinical setting. One, just to get the opportunity to prove it in a clinical setting is a major bridge to cross. So that's just by the nature of what healthcare is, it intensifies everything you do. Once you develop and improve something, the system, when you look at the healthcare system, I was amazed by the lack of data to support an in-depth analysis. Interoperability, that is the ability to share data between systems and between even silos within systems, is still a challenge. There remain hospital systems and clinicians that don't have electronic health records. And oftentimes you'll find the electronic health records are rigid and they're misused. Rather than looking for the right code for that procedure, physicians will find it's easier to just use a comment field. And so a lot of the critical information you would need to do some of the analysis is not really accessible to you. And the other thing that's challenged, because you have the hospital system and the payer system in two different worlds, the clinical data is separated from the claims data. So it's hard to match your outcomes to your costs. And these are not new problems. These problems have been there forever. But as you try to really implement a new change and prove that it's functioning, these barriers really get in the way from an ability to do that. And there is a lack of transparency around healthcare costs, and a lack of defined standards. All of these things are being worked on, and you could cite thousands of efforts probably to improve each of them, but they still remain a barrier to innovation within the healthcare system. And they're a challenge for anyone who's trying to live and build new technologies within that system. Hospital systems are complex. There's a lot of mergers and acquisitions, and what they've created is complex organizations. Often they're siloed from one another so that each hospital has often you'll find each hospital within a major system has its own board, has its own management system, has its own budgets. Sometimes they'll have even hospital-based IT staffs. And then you also have hundreds of practices and outpatient centers, labs, and clinics that don't communicate digitally or managerially. You have complex systems of management and leadership, and then you have service line leadership. So I have a hospital, Mayo Clinic has a president of the hospital, but then the cardiac team has a lead, the neuroscientists have a lead, and so it's a real matrix organization that can be complicated to work through. And then you have to layer in the governing committees, the clinical committees, lawyers, the internal review boards, and the other things that will get and become part of your development and innovation process. I'm going to pause right now. Does anybody have any questions? We're good, Allison?
Yep, I don't have any in chat.
Okay, thank you so much. It's also, healthcare is heavily related and regulated, and again, it's because of the importance of what they do. We have the FDA, JCO, legal requirements, compliance, the internal review boards, confidentiality and HIPAA and data security. And when you're putting a system into healthcare, you'll have to check off every one of these requirements that could apply to you. And they can be very lengthy. When we do, for example, we do programs for the pharmaceutical industry to explain new drugs. Every script and every program has to go through an entire internal review board review, an IRB sign-off that takes weeks. And you have to consider that. And they review it when the script is written, then they review it when the video is produced, and they review it in their final say. And they control over what kinds of claims can be made, what kind of language. So there's an awful lot of scrutiny if you're operating within healthcare. And we mentioned your HIPAA requirements and your security requirements. And one of the things to keep in mind is that the penalties that surround HIPAA violations are huge. Depending upon the tier of violations, it can go up to $50,000 per incident, up to $1.5 million. And these happen all the time. And not only do you have to worry about penalties from HIPAA, you can also have malpractice. Malpractice lawsuits that come about because of innovation. And I just pulled 3 examples of malpractice that were tied to an innovative technique or an innovative system. And in these, they're claiming that these were untrue. But you can see these New York hospital paying out $62 million, a physician who performed a thigh operation paid out $60 million, another unproven technique used with a lawsuit settlement of $30 million. So there are very real ramifications to innovations and care plans within the healthcare system. And another element is it's a complex buying process. Decisions are often siloed by healthcare segment. So the cardiac team may make the decisions about what systems and operating systems, with educational system and patient engagement group they use, but they will also be strapped by the information systems, the internal computer groups that will have, they'll impose restrictions on what can be done and how it can be done. And there's many decision makers at every level. And there's also many decision influencers, because when you implement that system inside a hospital setting, everybody who touches the system is going to be, is important to guarantee its success. There's also many gatekeepers to get into the hospital system and in the door. And even if the clinician loves the solution and finds it different and finds it something that he wants to use or she wants to use, formularies that limit treatment choices have to be changed in order to make your product accessible and to be paid for within the system. And all of those jumping through hoops point to a very long sales cycle. Our sales cycle per hospital for a new hospital is easily 18 months. And that's very similar to what other people, other companies that I've talked to complain about the length of a sales cycle within the healthcare industry. There's also evolving payment models. Before, everything was fee-for-service. It's evolving to value-based and bundled payments. But again, through politicizing the healthcare, we've sort of gone back and forth on whether or not we had a true focus on moving toward value-based or moving back to fee-for-service. It was all integrated into the Affordable Care Act. So the political football has really made this challenge a moving target, I'm afraid. And there are actually, so you have the fee-for-service, you have the bundled payment, but there's also another variety of a hybrid that exists today. We have a program on liver transplants. And what you have in liver transplant is you have a negotiated payment. So there's an agreed to amount paid to the hospital of, I don't know what today's setting is, but $800,000 per patient that covers from the from wait list through the post-surgical care for that patient. And who benefits in this kind of a fee-for-service from an innovation can change over time. So if I'm in a hospital that operates in a fee-for-service where everything gets billed, reducing readmissions is actually a reducing of their income, except when you get into the rules that now say certain levels of readmissions will receive no payment and no compensation. So now you're flipping so that the readmission that used to be actually a revenue generator is now a cost nightmare for the system. And all of these are shifting as you move through the system. And another point I wanted to make is that providers are incredibly stressed, especially with COVID, They're doing more with less, they're overloaded, they're operating under razor-thin margins, so that it's easy to go underwater with their operating system. And when you look at someone who has such a stressed workload, the thought of trying something new or changing an innovation, those all take time. And it's hard to find people who want to take on a new responsibility to look at innovation. So keep that in mind if you're looking to go after the hospital systems, that you'll run into this. People are just, I've had an experience where I was with a hospital system and we had 25 people in a presentation and they all loved the idea and were really eager to move forward. And they all left the conference room, discussing how they were going to move forward. And then 6 months later, nothing moved forward. And I went back to the people in the meeting and I said, what happened? And they told me that we love the idea. We really want to do this. But when I got back to my desk and saw that I had a foot-high stack of papers that had to get done, and I just didn't have the time to get to the nice-to-have things. And I realized that this was out of our reach and we couldn't really take it on. So these are all the bad news about dealing in healthcare. Then you have the fact that different personalities that are quite common in healthcare can also impede adoption. Certain systems really will they want to stay, they don't want change. They only want to do what's invented locally. Physicians don't like to be challenged. They want to maintain the ability to control their system and have freedom to follow care plans as they want. And you'll find there are conflicting motivations within the teams. Again, the problem of I don't want anything that wasn't invented here, and nobody does it better than we do. I've seen all of these as we go and talk through the various systems and various ways, and they can all lengthen and or stop the sales process along the way. There's also a complex system of payments within the hospital that you need to understand. You have third party, the government or private. Insurers have to improve the innovation and a price before people can get compensated for it. And insurers may block you. So this is just an example of the sources that are out there for covering payments within the healthcare system. And it breaks it down into the age of the population, employer-based, other, and then within that there are just many variations that have to be considered when you're doing this. This is a dominant discussion today in healthcare is so much of healthcare has nothing to do with the healthcare we deliver. So much of healthcare inequality and the true health of the population is dealing with the social determinants of health. And those are economic stability, whether or not you're employed, your income, debt, do you have medical bills, your neighborhood and your physical environment, how healthy is your housing, transportation, do you have places to work out and exercise, do you have healthy food, education and literacy, and the community and social context. All of these have a far greater impact on healthcare than the actual delivery of health through the healthcare system. And this is a major challenge that's under discussion. And I think it represents a great opportunity for innovators and technology companies to really focus on these kinds of challenges. So what is my takeaway about opening and starting an innovation in healthcare? I think some really simple guidelines would be, because it's a system that is so difficult to change, I think it'd be best to target innovations that improve existing procedures rather than require a complete adoption. If you're introducing a new product into healthcare, focus on the ease of use and focus on making the sale as easy as you can and the product as easy to implement in the system. And as you're planning the rollout for a product within healthcare, be sure to map out the workflows and the impacts for all the stakeholders in healthcare so that you don't end up surprised by being blocked by someone that you didn't even understand was part of the utilization of your process. Understand the buying process for your product, who would make the decision at what level, and when in the year they do that. It may be that those approvals are only made one time in the year in the fall, And if you start your sales process in December, you're going to have a problem. Also understand the path to scalability. I've been told that one of the biggest problems in healthcare is people develop an innovation within a hospital system, but then they're unable to make the leap to broadly sell that to other providers and payers or other clinicians. So understand the minute you're starting to look at your program and product and device, how you're going to scale it through the system. Prepare for a long sales cycle. So you're going to need the funds to survive. If you really are going to, the early 18 months may be short at looking how long it is to get into a new hospital system and close the deal. And also prepare for low success rates. With all of the issues that I've raised and described, the likelihood of you coming up against one of those is probably very high. But all that being said, I'm here selling into healthcare, and we just don't give up. One of the things that the most gratifying thing about being in healthcare is when your product works, you change lives. You improve lives. You see people having a better outcome. We can see people utilizing the program. We can see them asking questions and getting their answers. And one of my favorites, we had an interview with an engineer who found out he was going to have surprise open heart surgery. And he used the system. And afterwards, I asked him, what made a difference but by the fact that you used our program to prepare for your surgery? And he said, well, you kept me from having an infection. And I said, well, how is that so? And he said, you told me to use a new towel after I shower. I always use the same towel for at least a couple of weeks. So those are the kinds of simple changes that you're really impacting people's lives, and it really is gratifying in that way. So I said never give up, and I just want to encourage you all to never give up, because it's hard to beat a person who never gives up. So I'll close with Babe Ruth saying there, and see if there's any questions you have or anything you'd like to talk about.
Thank you for joining us, Ginny. Do we have any questions?
Hey, Ginny. Yeah, I just wanted to jump in. First of all, say thanks again as well very much for taking the time and for going through all this. This was really great talk, very informative. So appreciate that a lot. I guess one question that I would have is, what tips would you give for people who don't necessarily have a background in healthcare but want to kind of explore the industry more? How can people do more customer discovery in the sort of healthcare space, particularly when some of these systems and processes can be so complex?
I would recommend recruiting a clinician to be part of your team. I like to say, oh, you're fine, you can study it enough because you're all Tepper and you're so smart. You can, and God knows you like to work harder than anyone in the whole world. But the truth of the matter is, in my feelings, people may feel differently. If you don't have clinicians and insiders on your team, you're going to be very, very challenged to come up with an effective solution in healthcare.
Gotcha. Thank you very much.
And Ginny, I have a few questions in chat from Kara. We have, do you see a difference in selling to hospitals versus insurance agencies?
Yes, because it's very different because of their focus. And I'm just going to use an example of selling to Allegheny General Hospital. You're selling to the cardiologist who is actually defining the care plan for the person going through the surgery. So they really are looking at the direct care for that person. Now, if you jump across the walk and you begin selling to Highmark, now you're selling to 5 million members who may go to hundreds of different hospitals for different care within different settings. So how do you sell? So the same products need to be customized for the provider approach versus the payer approach. And that very, very different effect is going to be a challenge, and something you can do it, you can accommodate for it, and we have, but it's something to really focus on and make sure you talk to the insurers and the payer reps and talk to the care clinicians so that you have both of their view of your product and your plan. And then you also have the integrated systems where you have the payer and the provider within one unit, and they're the same. And actually, Highmark is an integrated system with its ownership of Allegheny Health Network, but they also deliver healthcare through many providers that are unaffiliated. So does that answer your question, Kara?
Yes, it does. Thank you.
Thank you.
And I have one more in chat from Lisa. What would you say has been the most effective in convincing stakeholders to adopt a product not built in-house or word of mouth?
The data, the outcomes, being able to prove to people that it made a difference. And it also makes a difference if you get that data with some very prominent providers in the industry. For example, we did our cardiac surgery work with the Cleveland Clinic, and the Cleveland Clinic is rated as #1 in cardiac care in the world and has been for the last 10 years. So being able to flaunt that that's where you learned how to educate people for cardiac surgery, and then be able to share data showing the patient satisfaction and the fact that that system is now buying more from you. Those are the things that really ultimately help prove and get you into the other areas.
And then one more question. Do you have any tips about how to enhance adoption? It seems that many excellent tools are built, but simply don't end up getting used by workers. What is best to focus on?
One of the things that we've really focused a lot on is the workflow analysis. It actually it's a bigger challenge than I envisioned when we began creating the programs to understand exactly. So we're creating a program to help a patient who's going to have open heart surgery. What exactly are all the processes that have to happen for a patient who's going to get scheduled to actually get access to the program? Who are the people that have to touch it? And so it's not the surgeon who has to be convinced, it's the scheduling nurse who is actually doing the pre-op visit with the patient, who has to agree to hand out the information and reinforce it in the same way. And it's the way the product is described to the patient when it's introduced. We found, for example, when we told that we had a script that we gave to the care team when they educated patients about the program, and originally it said, you'll learn a lot through this program. But then ultimately, there was a lot of data that showed that an educated patient had better outcomes. And they began telling the patient, this will actually help you have a better experience. It'll help you reduce your anxiety, and it'll help you have a better outcome. And when we changed the messaging from how we described it to the patient, it went from about 70% utilization to about 90% utilization by the patient. The one thing that is really a problem, and another thing that I didn't realize, is in some ways the patient is inundated with information. So it's how do you break through all the paperwork that they get, and how do you become a meaningful contact for them and something that really has an impact. When we talk to people who don't use programs, who didn't use the programs and followed up, they said, I just got so much information, I didn't even know where to begin. So those are some of the challenges we have in terms of how to break through.
And then I have a question from Dan. How would you recommend entrepreneurs get started creating MVPs, prototypes for solutions in healthcare when there are those HIPAA regulations and privacy concerns?
It's a challenge. Again, I think you have to be working with a clinician who's willing to guide you as to what are the characteristics that are that must be built into the MVP, and what are the steps you have to take in order to move through the system and make your product a reality. It's doing it in a partnership with clinicians. I can't emphasize that enough. It's the rules of the inside game, not only understanding the rules, but having someone who can walk you through it and make those introductions. Is really the way to do it. And, you know, it's just like everything else. There may be 1,000 physicians, you know, but you're going to find that maybe only 10% are true innovators and candidates to be a champion. But when you find those people, they are treasures. And those are the people who improve healthcare. But not every doc you meet, not every clinician you meet is going to be one of those innovators. But you'll spot them with some research in the area you're looking at, who's writing the articles and who's going to the conferences and who's speaking and who's really looking for innovation. And colleagues know, if you talk to colleagues and ask, who within your system do you think would be most likely to be innovate with this? And I think you're in a good environment in Pittsburgh to do that, only because we're like the smallest big city or the biggest small city. I don't know which it is, but if you go to New York and you say, I'd really like to meet the head of cardiology for New York Presbyterian Hospital, it would probably take you 4 years to do that. If you were a new person coming into Pittsburgh and said, I want to meet the head of cardiology within UPMC, you could probably accomplish that in about 6 weeks, just through the limited connections, the points that you need in order to get through everything in Pittsburgh.
And do we have any other questions? Okay. Well, I think that's all the questions we have for you today, Ginny, but I want to thank you so much for doing this. It was great. And then just reminding everybody that we will be posting this on YouTube as well.
And if anybody has any questions for me, if you reach out to Allison, she can share my contact information. I'd be happy to help.
All right. Sounds great. All right. Thank you.
Have a great day.